colleagues' efforts to combat uh, uh, this pandemic disease. But the only thing I say, my daughter works at Mass General Hospital in respiratory, and she has been telling me now the cases they receive are people who are not vaccinated, and those people, some of them suffer at the hospital because of the treatment, and some of them die. So I advise everyone, do not wait until you are in ICU suffering the pain of this pandemic disease. Just get vaccinated and seek awareness. Seek awareness.
Mm-hmm.
Like, people need to try to convince themselves that vaccination is a must, is a duty that they need to do.
Thank you, thank you. And I really want to encourage, and I think this is what's happening really with the co-organizers of this. Really wonderful that we can have this cross-pollination between religious leaders and community organizers, and all of us in the audience. So it's really on us now, and as we go out, to take these important messages and share them with those in our neighborhood, beginning in our families, in our communities, in our workplace, and share that out, because this can actually save lives. So I would like to round up by saying that we are going to have another poll come up. The speakers should not answer the poll, but every other participant should please try to answer that poll. It's really important to get that feedback, so that we can continue to in the future know what to do, develop this programming that's really relevant. So at this point, I want to thank all our distinguished panelists for that very rich information that has been shared, and for spending some time with us this morning. I want to thank the audience for participating, for joining us. And at this point, I'm going to turn over to Repker and Dr. Egbe, who have been wonderful in organizing this important session.
Okay, so I'll give people a few seconds to complete the poll, and I will get started. Not to just, yeah, so Dr. Igbe, you want to go first, or shall I just?
No, please go first, so that we have 4 more minutes, so we can let people go when we promised, so they can join us in December. Thank you so much. Okay, so please go first.
Okay. All right, this has been really a fruitful conversation, and not only just a discussion. First of all, thank you, Dr. Nawal, and thank you for all the panelists, really for the religious leaders and community leaders and healthcare providers. Extremely fruitful conversation. I'm trying to really keep up with my notes, writing furiously, and have copious notes, and also the notes from the chat. And Dr. Nawal and I at Hopkins, we've been having so many conversations about community and engagement and cancer prevention and health promotion in general, and including the faith community. So I think you would agree with me, Dr. Noah. We got so many fruitful information to add to our toolbox, and I'm sure you will agree too, Dr. Igbe. So please continue the conversation, the discussion. Check out the chat, and please come back for the next session. Just quickly summarize it. I'm going to do an injustice in terms of summarizing, but I'm going to share a few highlights from the conversation today, and the importance of coordinating or working together was reiterated again and again and again. So it's not having these siloed approaches to addressing vaccine hesitancy, just the faith leaders or healthcare providers, youth advocates and others, but really thinking more collectively, how can we work together and be very intentional about that approach, so that we have a systemic approach to addressing this. I like the term circle of influence that one of our panelists used, and really, and also amplifying that the vaccine is safe and effective, and due diligence was imposed, was practiced in terms of research to bring this to fruition. It was not an overnight situation. It is a quote from that conversation today. Also, it is a sin not to be vaccinated, or as stated by the Imam, which is really a powerful statement. We need to educate ourselves of people's concerns. And that was stated by Dr. Dioe, because, if we have to understand people's fears, people's concerns, people's beliefs, so that we can have targeted intervention. If we can't really go with a cookie cutter approach, it has to be really targeted efforts to address people's beliefs. And in terms of targeted effort, I think what Adiole and Dr. Grace also mentioned about, even in terms of how we work with the communities, we have to have a targeted approach. And we also cannot leave the rural communities, and as Dr. Grace emphasized again and again. So when we think about increasing vaccination in Africa, we tend to focus so much in urban areas, but the majority of our population in Africa live in rural areas, so let's not forget about them. So access is a very serious issue and concern there too. So what do we do about it? South Africa has like extensive mobile vaccine service, and others can also approach that. I love Dr. Adirale's comments about making churches accessible in all kinds of ways, having on-site vaccination during high traffic time, and they have ample parking also to facilitate drive-through vaccination as well, and creating a faith-based network of influence is a really important point shared here. And we have to also think beyond the vaccination, beyond COVID, sustaining that faith-based network and systemic approach beyond COVID. How about applying that to cancer prevention effort? Cancer is a growing serious concern in Africa we're not sufficiently addressing. So think about beyond the systems that we are setting up to address this COVID health issue. When you look at it on the positive side in terms of what it is making us do, is really think about systematically and strategically what our approaches to addressing health. And as stated again and again by the Imam, by the pastor and everybody, is that faith leaders need to be in the forefront, to be seen taking the vaccine. They are the voices of the community with great influence. So let's make that happen. And I love the idea of enlisting survivors as ambassadors shared by Dr. Grace, and we're not doing enough of that. So that's a really key point. So many points that Amisa made in terms of community engagement, and especially having young people be part of that effort, because we tend to think that young people dismiss this problem, but they have a really critical role to play, and they themselves are impacted by COVID. And don't wait to die before you call for vaccine, because that could be a bit too late. So those are a few points to summarize that what I heard. Dr. Igby, I turn things over to you. And
okay, so sorry, we're a few minutes behind, but thank you so much for everybody for joining us today. It was a very rich conversation, and I hope some connections may be started here, maybe between the community leaders and the religious leaders. And Dr. Wuntomlade, your 12-point suggestions, very noted, and we will make sure they also get to other places, and I'm sure people from here can share them. But I'd like to say thank you very much to everybody. And on December 9th, one of the issues that's been raised in this panel, the other panel, has really been the role of social opinion makers and social media. And those are some of the issues that we are planning to explore on December 9th. So please join us. And if you do have any comments, suggestions, or questions so far today, please send it to us. Well, thank you so much. We really appreciate you joining us this Thursday night evening, afternoon, morning, wherever you are. Thank you so much.
Thank
Bye.
you.